Welcome to the Friday, December 1st edition of the SVG-TV News. I am Khalil Kato with the details. Recipients of the government's public assistance programs will be receiving their payments in a more modernized way from cash-to-card transaction through a reliable ATM card from the Bank of St. Vincent and the Grenadines. The public assistance transition from cash-to-card implementation strategy is being spearheaded by the Ministry of National Mobilization, Social Development, the Family, Gender Affairs, Persons with Disability, Youth, Housing and Informal Settlements Social Protection Department. At a news briefing today, Acting Prime Minister Montgomery Daniel said the new payment system is historic for both the government and the recipients of the cards.
Presently, public assistance clientele receives $275 per month, and this money is being paid at different locations throughout St. Vincent and the Grenadines, including the Grenadines. And of course, this system has its challenges, but in an effort to modernizing its approach, this payment system to the public assistance recipients will now be done through the banking system. And of course, you heard from the representative of the bank how much that they themselves are interested in partnering with the government. The banking system will now be used for such payments. In all of this, recipients will now be given a bank card to withdraw their monies.
Minister Daniel said that Minister Daniel said to ensure that persons received full payments from the bank, Cabinet approved an increase of $5 to the public assistance money already being paid to individuals so that they can satisfy the transaction cost of the bank.
My understanding, however, is that the cash delivery at the bank is done only with banknotes of $20 and $100 bills. It means, therefore, that the public assistance recipients will not be able to withdraw all of their monies at any one given time. Therefore, in an effort to give all of the money and make that money available to the recipients, of course, today, here at the Cabinet will approve an increased amount of $5 to the $275 that is now being paid monthly to an amount of $280 so that the recipients can withdraw all of their monies at any one time if they so wish.
Minister Daniel said that the transition to reloadable card pay is necessary to reduce the operating expenses and risks, noting that the new payment method comes at a lower cost than previous methods.
Indicate that this government, in such an approval here at Cabinet today, is attempting to sustain the new payment method that will cost the state $833 per month, or an average of $10,000 per year, by introducing the reloadable ATM card to the public assistance program that will usually cost the state $22,290 per month, or $267,480 per annum, to the delivery of the payment in cash at all 15 payment districts nationally. It's important to note that this is indeed a cost savings to the government.
Minister of National Mobilization Orlando Brewster said that the reloadable cards will be handed out to the recipients from Monday, starting on the windward side of the island.
Announcement and the existing general location where persons can go and collect the cards and the cash are as listed as follows. On Monday, 4th December 2023, at the existing payment districts in Connery, at the Connery Learning Resource Center, you can go there. So I repeat, on Monday, December 4th, 2023, the payment districts where you can go to be assessed, interviewed, and collect your card if it's ready are the following: Connery at the Connery Learning Resource Center, Sandy Bay at the Sandy Bay Anglican Church, Oya at the Oya Police Station, and in Fancy at the Fancy Health Center. And this would be posted on different mediums as well. API would make the announcement over the radio, and I'm sure that the television news would also carry this.
Minister Brewster said over 600 persons have not yet been interviewed as part of the assessment process to get one of the reloadable ATM cards.
So we have to do some verification as well in that aspect. However, we have an outstanding number of 677 persons who have not yet been interviewed. And we are urging you, and you would hear subsequently where you can go to conduct this interview process so that you can be placed immediately on the reloadable cards. So if you are out there and you're listening to me and you have not been interviewed or assessed for this card, just listen closely and you would know exactly where to go so that we can have you placed on the program. So, but the majority of the public assistance program, based on the number, they have already been transitioned onto this program of the reloadable card.
In August 2021, the Ministry of National Mobilization, charged with the national portfolio of social protection of the indigent, poor and vulnerable, received cabinet approval to pilot the BOSVG reloadable card payment mechanism with 500 beneficiaries. This payment mechanism was expanded in 2022 to the VEEP project for 3,994 beneficiaries and the COVID-19 Relief Income Support Project for 680 beneficiaries for a 6-month period ending December 2022. The pilot program was approved with the intent of expanding to all components of the public assistance program, commencing with the Vulnerability Grant, which facilitates the Poor Relief Program with an average of 4,775 beneficiaries per month per annum. The National Insurance Services, the NIS, today hosted a Pensioners Appreciation and Health Day at its office in Capital Kingstown. The pensioners were treated to breakfast and a number of services were made available to them, such as nutritional counseling, free eye testing, GMR and BMI testing, elderly pedicure, and pharmaceutical consultations. Addressing the opening ceremony, Director of the NIS, Stuart Haynes, said he is happy to be part of the event to celebrate and recognize the pensioners.
It's you who have laid the solid foundation for the NIS. Also, you have paved the way for persons like me and my generation, and indeed generation to come, to stand proud as a Vincentian. Your hard work and commitment to this island we all love and call our home have given breath and life to the institution we all know today as the National Insurance Services. This organization is here because of you. The National Insurance Services not only provide the monthly safety net for our pensioners, but it's important to note that our coverage is comprehensive. We have sickness benefit, we have maternity benefit, we have invalidity benefit, we have funeral grant, we have survivors benefit, we have employment injury benefit. We also manage the fund with due care and diligence to grow the fund, and at the same time, we have to contribute to economic development. It is these funds that came to the aid of this country during COVID-19 pandemic. And also it was these funds that further helped our country through the fallout from the volcanic eruption. Without a doubt, our NIS is a safety net for our people when we are most vulnerable. And it is through prudent, strategic, and professional management of the fund throughout the years since 1987 that we have been able to do all that we have done and are buoyant as we are today.
Noting that the NIS is a fundamental pillar of the Vincentian Society, Haynes said while it is an honor to lead the organization, he understands that with great privilege comes great responsibility, and it is a responsibility he takes very seriously.
Because I understand that this fund and this institution are a safety net for our nation. Very important. We have been the subject of national debate recently. As an actuary, it is my job to analyze the risk using different mathematics, statistics, and financial theory. My job is not about one guessing or posturing. I have analyzed our numbers. Other independent actuaries have analyzed our numbers. The World Bank have analyzed our numbers. And independent consultants have analyzed our numbers. And St. Vincent and the Grenadines, just like every other social security system in the region, must reform now to ensure that this safety net that we have for you, our pensioners, and the other categories of vulnerable Vincentian that we serve is here now and in the future.
In regards to reform to secure the NIS, Haynes stressed the importance of protecting families and the country's most vulnerable, with all Vincentians having a current and future stake in the NIS.
National program, and it's for all Vincentians. Reform is the only sustainable way forward. And you'll hear our plan how we secure our future together. Because the staff at NIS cannot do it alone. The board at NIS cannot do it alone. We need you, a very important stakeholder, our pensioner. How do we secure our families and St. Vincent and Grenadines' most vulnerable? As the director, I am proud to report that we are celebrating a family of pensioners with a membership base of 9,349. That represents 8.5% of our population. So it's 9,349 pensioners. Within this family, we have 1,615 survivors pensioners. So it's not only persons who retire, but we have kids, we have widows, and we have widowers. And also among our family, there are some persons who are challenged health-wise, and we dub them as invalidity pensioners. They cannot be here now. They are at their home because of their condition, and there are 163 invalidity pensioners. Then we introduced a program in 1996 that provides protection for economically challenged elderly persons. And today, we have 296 non-contributory pension with an average age about 80. And our contributor pensioners is about 7,275. So we see our family is growing, and it will continue to grow.
President of the United Arab Emirates, the UAE, Sheikh Mohammed, has welcomed the world leaders to COP28 with a pledge to create a $30 billion fund for climate financing. Sheikh Mohammed told an audience of prime ministers, presidents, and heads of state that the fund is designed to bridge the climate finance gap. Named Altera, the fund is described as a catalytic climate vehicle that will be used to bolster climate financing. Sheikh Mohammed said access to affordable finances to invest in clean sources of energy had long been a barrier to the clean energy transition. Noting that the climate talks come at a time when the world faces many challenges, the president said when they committed to hosting COP28, they pledged to bring together the world to unite, build, and deliver. The Emirates has a long history of climate work, he said, including a pledge to achieve net zero by 2050, reduce carbon emissions by 40% by 2030, and invest billions in clean energy. Meanwhile, in an interview with NBC Radio on the sidelines at COP28 in Dubai, Nafisha Richardson, sectoral chairperson on climate change on the Prime Minister's Youth Advisory Council, said she is particularly interested in the outcomes of the first global stocktake.
So as I am engaging in various negotiating rooms, my track for COP28 is mitigation. It's always so important that 1.5 remains at the forefront, and the unique vulnerabilities that small island developing states face, that they are also at the forefront of the work that I am doing. As I mentioned, I am following the mitigation track, and we are working on producing a document relating to the mitigation work program. It is my first COP, and I must say I'm a bit of a novice, and I'm just learning from the experts and the experienced negotiators. And even though I was thrown off into the deep end, thus far it has been a phenomenal experience. I was very happy to see yesterday significant pledges made towards the loss and damage fund, and I look towards, as the COP continues, to seeing perhaps even more contributions being made, and just in general a lot of strong commitments towards achieving and maintaining 1.5 and ensuring that our globe, our shared home, is resilient. So as many of you may know, December 1st marks the end of the transatlantic hurricane season. And it's a moment for us all over the globe, but particularly in the Caribbean region, where we're all on edge with impending hurricanes and storms. We know that rising temperatures also equate to rising sea levels, and thus for small island developing states, it's super important that we stick to the science. And we know that the IPCC has mentioned that 1.5 should be our main objective, and that's something that we hope to look for. So that's why the global stocktake is so important, so that as we take an inventory of where we are to date, where we are currently, we can know, okay, this is where we're at and this is where we need to go to ensure that these goals that we have and these ambitions that we have are realistic, and that we can have really strong outcomes in the end.
SVG's delegation to COP28 is being led by Prime Minister Dr. Ralph Gonsalves. President of the Caribbean Development Bank, Dr. Hygienius Jean Leon, spoke with NBC Radio on the needs of the region with reference to climate change and access to adequate and affordable financing. Here's a bit of what he had to say.
So in terms of expectations, what I am hoping is that the global stocktake one would make it very clear that we are in a very urgent situation, in that we have not done adequately in the mitigation space. And with climate change, temperature rising being urgent, and up to this morning we heard that 1.5 could be breached by as early as 2030, not 2050, not 2035, as early as 2030. What that would mean is that we do not have much time. So it is urgent, it is critical, and for countries like ours, we are not expecting 1.5 to damage us. At 1.1, 1.2, we are already experiencing damage. And so I make the point why the world needs to manage mitigation to prevent further quicker losses arising from climate change. We are already living that climate change, and living that climate change means that we will not be in a position whereby we can, in principle, talk about mitigation all the time. So adaptation, mitigation are in one breath important for us. And so if we could, one, get this 100 billion pledge going, two, we can get commitments to more adaptation funds going. It doesn't have to double, but more. That would be important for us. If we could get not only pledges, but the mechanism through which loss and damage will be effected, that would be a big plus for us coming out of the COP28.
World AIDS Day is being observed today under the theme Let Communities Lead, which is a call for action to enable and support communities in their leadership roles in the global fight against HIV/AIDS. Today is a day where people around the world unite to show support for those living with and affected by HIV and to remember those whose lives were lost. According to statistics, every day in Latin America and the Caribbean, 44 people get infected with the virus, while 11 people die daily from AIDS. On NBC Radio's face-to-face program today, infectious disease specialist Dr. Jose Davy said there are persons who may have tested positive for the virus and neglect to seek care, and when they do seek help, they are critically ill.
Although we have done great work, we still need communities to realize that it's still somewhat of a threat. So hence the reason why we've chosen Let Communities Lead, because now the onus is on persons to look at their continuous risk. We also know that there are persons who may have tested and they do not come into care. So by the time we get them, they're severely ill and sometimes very sick and dying. And in 2023, we really shouldn't have these things happening because we have everything available for persons to be happy and healthy.
Dr. Davies said currently in St. Vincent and the Grenadines, there are 430 persons receiving antiretroviral treatment for the virus. Noting that everyone is at risk once they are sexually active, Dr. Davies said Dr. Davies said they are seeing a lot of young people testing positive for the virus in the age range 17 to 25 years old.
For instance, last year we had 54 cases, but generally it staggers around 35 cases a year, which I think is still significant, although we would be termed, low burden. The Caribbean still has the second highest HIV infection rate, or what we call prevalence, in the world, second only to sub-Saharan Africa. So we need these numbers to come down. So it's as if they've forgotten that this thing exists. And when I'm talking HIV, I would like to emphasize all other sexually transmitted diseases, because if you're exposed to one, then it increases your risk for others. So people are forgetting that they have to know what they're doing, in a sense. You're going to have sex, you need to know the status of your partner. If you don't know the status of your partner in that instance, you're going to have to use a condom.
The infectious disease specialist used the opportunity to outline several ways in which persons can transmit the virus and explained what the treatment pre-exposure prophylaxis, PrEP, is used for.
Transmission of HIV is having sex, whether it be vaginal sex, anal sex, and to some extent oral sex if there are cuts and breaks in the gum. Also, a mother can pass the virus to a child, although that's less these days. Any exposure to blood and body fluids. So it really is everybody who is sexually active would be at risk. So what we do for PrEP, or pre-exposure prophylaxis, is that you come, and there are two aspects of PrEP. I know the time would kind of limit me as to how much I would say, but to make it simple. So let's say you're going to have a risky exposure. Perhaps you're going on a weekend and you may be intoxicated, not that we're advocating that, and you may not be able to make the best decision. Then you can access something that we call PrEP on demand. So, and then the other aspect of PrEP would be continuous PrEP. So let's say, for example, there's a relationship and one person is HIV positive and the other is negative. The best option for pre-exposure prophylaxis for that person would be to be on continuous PrEP. So the medications that both ends take are the same. It's a combination of tricycline with tenofovir. I know, big words, people get scared, but it's a combination pill, meaning that those two drugs are in one pill.
Dr. Davy is advising everyone who is sexually active to test annually, noting that rapid tests are available for free within the Public Health Division, including district clinics, the St. Vincent Planned Parenthood Association, and the Infectious Disease Clinic every Thursday. A tourism and health program was launched yesterday afternoon at the Beachcombers Hotel conference room. The program will support the strengthening of the country's capacity to prepare and respond to public health threats in the tourism sector, which enhances the health and safety of visitors and locals and improves the quality, competitiveness, and resilience of St. Vincent and the Grenadines' tourism industry. Speaking at the launch ceremony, Chief Medical Officer Simone Kieser Beach noted that because of the COVID-19 pandemic, the Ministry of Health saw the importance of partnering with all stakeholders, especially the Ministry of Tourism.
We learned about health security. As Mrs. Bascom says, health security is national security. The Ministry of Health's motto is your health, a shared responsibility. The Ministry of Tourism says that tourism is everybody's business. And you see the similarities there. We recognize that we're all in this thing together. We have to work together, and I'm very happy to welcome you to the launch, the official ceremony, as Dr. Duncan, Roger, I won't say what else we will call him, said this is just the culmination, this is the pretty part of what has been an extremely hectic week and many months of preparation.
Meanwhile, Minister of Health Sinclair Jimmy Prince noted that tourists can be vectors to new pathogens to the country and explains why this program is critical to the country.
And particularly those of the OECS, which includes St. Vincent and the Grenadines, are heavily dependent on tourism as an important economic driver and strong pillar of national development. The sustainable development of tourism, its ability to mitigate external threats and build resilience, are of critical importance in realizing the best and most significant benefits of the tourism product which we promote and which we possess. The recent SARS-CoV-2 pandemic is the best example of an infectious disease threat that exposes the fragility of the industry. This recent event put the spotlight on the need to build strong, innovative, comprehensive, and truly multi-sectoral systems for addressing health and safety and resilience in the industry. Of course, we have been embracing the whole concept of One Health. We have been embracing the whole of society, whole of government approach towards health, and all of these come into play at this moment as we look at the important link between tourism and health.